Hello everybody, this is going to be a brand new series covering the brain, anything that has to do with the nervous system. Today we're covering stroke, we're going to be covering the nursing diagnostics, medical treatments, the pathophysiology, the anatomy and physiology behind stroke. So let's begin. Okay, so it's very important to talk about the cerebral blood supply in relation to a stroke. In order to understand a stroke, you need to understand the blood flow within the brain. It's kind of like the same example how you need to, in order to understand a myocardial infarction, you need to understand the blood flow of the heart. Or in order to understand congestive heart failure, you need to understand the blood flow of the heart. So same kind of scenario. So for the cerebral blood supply, it begins within the left carotid, the right carotid artery. What's significant about that artery is that this is where typically plaque can build up within, and it could break off, traveling into the other arteries, causing a major stroke. We'll talk about those other arteries right now. Those left and right carotid arteries then travel forward and become the left vertebral and the right vertebral artery that's located here and here. These two arteries then separate and become the circle of Willis that's located within this passage over here. The circle of Willis then separates into your cerebral arteries, the left artery, the left cerebral artery, and the right cerebral artery. What's important about the blood supply is that the circle of Willis supplies the brain with oxygenated blood supply. And the reason that's significant is because if the brain is not getting that oxygen that it requires, it's going to necrose and it's going to die. And when that occurs, typically that is when a stroke occurs. And there's different types of medical treatments that's involved with providing patient care in terms of a stroke. So that's why the importance of blood supply of the brain is very significant in understanding how a stroke occurs. Okay, so for a transient ischemic attack, it is considered to be a brief episode of cerebral ischemia, and it's not permanent. Those are the key words, not permanent. The good thing about a transient ischemic attack is that it's a warning sign that tells you that a patient could obtain a stroke in the future. So if someone receives a TIA, also known as a transient ischemic attack, it gives a person enough time to take precautionary measures to prevent an actual stroke. So the other difference is that it's not considered to be an infarction, unlike a real stroke, and it's gonna last a few minutes, less than 30 minutes. But the key thing about it is that it's cerebral ischemia. So what does that mean? Is that ischemia is the cells contain low amount of oxygen and it's not completely dead. Infarction is dead cells. There's no oxygen that's being sent to that brain, that area of the brain, therefore it has died. So what causes it? Well, it's an increased buildup of atherosclerotic plaque that either enters the vertebral artery, cerebral artery, or carotid arteries. So typically in the hospital, patients could obtain an ultrasound of the carotid arteries to determine if there's a buildup of atherosclerotic plaque to prevent any complications from occurring. So there's some treatments and preventions with transient ischemic attack. For treatments, lifestyle modifications, ultrasound of the carotid to prevent a TIA from occurring. Going back to lifestyle modifications, it's important to keep up with, exercise and diet to prevent, an actual transient ischemic attack from occurring. There's also some meds that a patient can take, such as aspirin, warfarins, and statins, to decrease that chance of atherosclerotic plaque buildup. And also, worst case scenario, a surgical intervention such as a carotid enterectomy. During a carotid enterectomy, the surgeon is going into the carotid and removing any buildup of atherosclerotic plaque that could possibly travel through the blood supply of the brain. Okay, so what is a stroke? Well, a stroke is a severe disruption of the cerebral circulation. So this results in severe tissue damage and ultimately the death of neurons with the loss of neural function. So this is the result of low oxygen supply to the brain, which leads to an infarction. Versus a TIA, it's more of ischemia. So let's say you're a nurse in the emergency room, patient comes in with the worst headache of their life. That's how they explain it. First things first, you want to do an assessment. So how do you assess? You want to assess with FAST, fast. Fast, the F stands for face. So first thing you want to do, you want to see if there's any drooping on one side. So is there facial symmetry? Is it symmetrical or not? Arms, you want to ask them to hold their arms out to see if one arm is weaker than the other, or if one arm is numb. Speech, you want to ask them to say a sentence like, I will walk my dog, for example. If the speech is slurred, that could be indicative of a stroke. Also, the timing. It's important for family members to bring the patient to the ER as soon as possible. Time is brain, meaning we don't have that much time to allow the brain to recover as much as possible. So they need to come to the hospital right away so they can get the proper treatment. So how do you diagnose a stroke? Well, the gold standard is we want to do a CT scan of the brain. We want to do it within 10 minutes. So we do a quick assessment. We're sending them to CT to get a scan of the brain. So what this is going to tell us whether or not if it's a hemorrhagic stroke or ischemic stroke. Hemorrhagic stroke, if it's hemorrhagic stroke, there's different types of nursing intervention that's associated with that, and same with ischemic. Okay, so there are different types of stroke. There's an ischemic stroke, and there's a hemorrhagic stroke. An ischemic stroke, there's subcategories of that. The first one being a thrombus. So a thrombus formation. So typically the most common cause of that is due to the buildup of atherosclerotic plaque, whether it being in the carotid arteries or the cerebral arteries. So what's going to happen is that since there's a buildup of that plaque within the arteries, there's not going to be enough oxygenated supply that's going to the brain. That results within a ischemic stroke. The second type of ischemic stroke is a embolism. So that's when a clot travels from anywhere other than the brain, such as the heart or the carotid arteries. So it's a traveling thrombus that causes the low amount of oxygen to go to the brain and perfuse it properly. So the third type of ischemic stroke is known as a lacunar ischemic stroke. This is typically caused by chronic hypertension. The cerebral arteries are going to hypertrophy. Therefore, there's not going to be there's going to be a low supply of oxygen that's going to be supplied to the brain. When the cerebral arteries, for example, are hypertrophied, the walls are going to become bigger and bigger. And what's going to happen is that there's not going to be enough blood flow to travel towards the brain to perfuse it. Therefore, it's going to increase the amount of lactic acid, and it's going to cause it's going to cause an infarction due to the low amount of blood supply towards that area of the brain. The second type of stroke is considered to be a hemorrhagic stroke. There are two subtopics within this one. There's an aneurysm and an arteriovenous malformation, also known as an AVM. For an aneurysm, how does that cause a hemorrhagic stroke? Well, it's due to the cerebral walls are weakening and they become dilated and an outpouching occurs. Here's a little illustration of the cerebral wall weakening and an outpouching occurring. What is that caused by? Well, it's caused by chronic hypertension. Also, alcoholism is a major factor of an aneurysm. So due to that outpouching, what's going to happen if the patient has chronic hypertension, it's going to cause this outpouching to rupture, leading to blood flow to escape out of that pouch and causing a hemorrhagic stroke. Also, if there's trauma, such as being hit in the head due to some kind of outside force, that could also rupture the aneurysm. The second type of hemorrhagic stroke is an arteriovenous malformation, also known as an AVM. So what's happening here is that blood vessels are tangled, and the high blood flow is going to rupture the entanglement. So here's our arteries, here's our veins. Arteries are considered to be highly pressurized, veins are considered to be low pressurized. So what's going to happen is that there's going to be an entanglement in this area over here. So within that entanglement, the high pressurized blood is going to flow to this area and it's going to rupture this entanglement over here, and blood is going to escape, causing a hemorrhagic stroke. Typically arterioles, for example, are supposed to slow the blood flow down before it reaches the capillary system. Okay, so when a stroke occurs, there's different types of manifestations of the location of where it affects. It causes different types of issues. So for example, with the left hemisphere, it's going to cause agnosia. Agnosia is the inability to recognize familiar objects. So if I'm looking at this marker, I won't be able to explain what it is properly. Alexia is also an issue of a left hemisphere stroke. That is the inability to read properly. Also, there's something known as agraphia, meaning the ability to write. There's also going to have right-sided hemiparesis and right-sided hemiplegia. Right-sided hemiplegia is also known as paralysis. Right-sided hemiparesis is also known as weakness. So these types of patients, it's very important to keep them by the nurses station, or in case if they get up to go to the bathroom, for example, because they have a easier ability to fall and really hurt themselves. There's also a right hemisphere stroke. So this is some attributes that goes along with a right hemisphere stroke. Is a patient may have an overestimation of their abilities, meaning they may perform functions that's out of their normal characteristics. They think they could, for example, lift something up that's extremely heavy, but they really can't. There's also unilateral neglect syndrome, so they're neglecting one side of their body. That's also another reason why to keep these patients next to the nurse's station. Also, there's a poor impulse. They become very impulsive. Also, there's a motor sensory deficit, specifically on the left side, and they might have left-sided hemiplegia, left-sided hemiparesis. Within the frontal lobe, if there's a stroke in this area, they're going to have a difficulty in concentration, having judgment. Also, personality may be affected, their personality may change. Also, this is where the Broca's area is within the frontal lobe. So they're going to have difficulty. They're going to be saying short phrases, and what they're saying is not going to make sense. Parietal, if there's a If there is a stroke in the parietal lobe, sensory input and sensory discrimination is going to be affected the most. If there's a stroke in the occipital lobe, there's going to be an issue with vision interpretation. Their visual acuity is going to decrease significantly. If there is a stroke in the temporal lobe, the Wernicke's area is going to be affected. So whatever they're going to be saying, they're going to be saying it in long sentences, and it's just not going to make sense whatsoever. Typically, these patients who have a Wernicke's aphasia become extremely frustrated because they know what they want to say, but it's just not coming out correctly. And also, they're going to have auditory, their auditory reception is going to be, decrease significantly if there's a stroke within the temporal lobe. Okay, so for the diagnostics for a stroke, first things first, patient comes into the ER. You want to run a quick assessment on this patient. You want to do B fast. The B stands for balance. Are they uncoordinated? Eyes, are their eyes pointing downward? Are they just out of focus? Facial drooping. Is one side of their face not symmetrical? Arms, you want to ask them to stick out their arms to see if there's any numbness or weakness. Unilateral. Speech, ask them to say a sentence if there's a slurred speech. That could be indicative of a stroke. And timing, you want to know when this all happened, because time is brain. This is very important for the nursing assessment because we need to know when the stroke started so we can time our interventions accordingly. So let's say the patient comes in, we want to definitely put them on oxygen because they're not getting enough oxygen being perfused to the brain. We also want to check their glucose. So why would we want to check their glucose? Well, it's because if the patient is hypoglycemic, meaning they're confused, they have a high heart rate, they're diaphoretic, this could mimics a stroke, so it's important to rule that out. Also, you want to activate the stroke team. You want to notify CT that a patient is coming down and they're going to need a CT scan of the brain. Also, you're going to be collaborating with the doctors as well, so you're not going to be alone in this process. Some imaging, like I said, a CT scan of the brain, that's the gold standard. It's going to tell us whether or not the patient had a hemorrhagic stroke or ischemic stroke. And based off that, our nursing interventions are going to be adjusted accordingly. Also, we want to do a blood glucose check. Like I mentioned, it's going to hypoglycemia is going to mimic a stroke, so it's important to rule that out. Also, we want to get a stat EKG. We want to know how their cardiac function is, what the rhythm is of their heart. So when the patient is getting their CT scan of the brain and you're at the nurse's station, it's important just not to stand around. We want to check their med list. So why would we check a patient's med list during this time? Well, we want to know if they're on anticoagulants. So why is that significant? If they're on anticoagulants, it's going to increase the chance of a patient obtaining a hemorrhagic stroke. So we want to have the reversals ready. So if a patient is on heparin, for example, if they're on a heparin drip, the reversal is protamine sulfate. That is considered to be the antidote. If a patient is on warfarin, vitamin K is considered to be the antidote of that. So that's important to monitor and also to collaborate with the physician. Some labs to draw. We want to know, we want to draw a CBC. We want to detect if a patient has polycythemia, increased red blood cells, white blood cells, thrombocytopenia, meaning the lack of platelets, and sickle cell anemia. We want to rule these disorders out because it could mimic a stroke. We want a metabolic panel. We want to review if the patient has hyponatremia, anything less than 135. Why do we want to know that? It's because hyponatremia could cause a seizure. So, and it could cause some symptoms of a stroke. So we want to rule that out. Hypoglycemia, we spoke about that. Also, we want to know, we want to do a coagulation test. Their APTTs and their PTINRs, if those are elevated, that means there can be a higher chance of a hemorrhagic stroke. So going back to the anticoagulants, heparin and warfarin, we want to have those antidotes ready to go. Also, it's important that labs aren't going to actually diagnose a stroke, but it's important to know that it's going to eliminate the possibilities of these disorders from mimicking a stroke. Okay, so there's immediate treatment for a stroke. So what are the immediate treatments? So let's say the patient comes back from CT and ischemic was confirmed. Okay, so what's the next step? Well, depending on the time of the stroke, if it's within the 3 to 4 hour window, so anything before 4 hours, a patient could receive TPA. TPA is a clot buster. So what is that going to do? It's going to destroy all the clots within the arteries, so blood flow could perfuse the brain properly. Well, what if a patient is out of that 4 hour window? We weren't able to get enough time in. What could be given? Well, the next protocol would, depending on the hospital policy, the next step would be aspirin at 325 milligrams. It's considered to be a blood thinner. So this is for candidates that weren't able to obtain a TPA. So let's say we get that TPA. Now we need to monitor their blood pressure. It's important to monitor their blood pressure on the hour, even a little bit earlier. So that's something important to assess. How about a hemorrhagic stroke? So patient comes back from CT and they had a hemorrhagic stroke. Well, first things first, we want to control the blood pressure, and we also want to stop the bleeding as soon as possible. Just by doing a simple nursing intervention, by elevating the head of the bed, it's going to decrease that intracranial pressure. Also, we want to monitor their blood pressure. We want to make sure the blood pressure is below that 160 range. Like I said, intracranial pressure is what we're monitoring for. Temperature. Why do we need to check the patient's temperature? That seems like a random intervention to do. If their temperature is elevated, well, intracranial pressure is going to be elevated as well. We do not want the bleeding to keep on progressing, so we want to stop that bleeding. Also, we want to reverse any anticoagulants. If a patient is on heparin, we want to give them protamine sulfate. If a patient is on warfarin, we want to give them vitamin K to reverse that process. Okay, so what is the acute care treatment for a stroke? You are the nurse in the ICU taking care of this patient. Let's say they had an ischemic stroke. Well, first things first, we want to monitor their blood pressure. Their body's trying to compensate. The RAS is going to kick on, their sympathetic nervous system is going to kick on, so we need to monitor their blood pressure. If their systolic blood pressure goes anything above 220, we want to even catch it below that. We even want to catch it around 180 if possible. Or anything over 220 is considered to be a danger zone. We need to notify the physician immediately. Mean arterial pressure, if that's greater than 120, same situation, notify the physician. We need to treat the patient with antihypertensives. We're not going to be allowing the patient to take any PO meds. We need them to take, they're going to be on IV medications, antihypertensives exclusively. Also, we want to monitor their temperature, because if their temperature is going to elevate, their intracranial pressure is going to elevate. Let's say the patient had a hemorrhagic stroke. There's a triad known as a Cushing's triad. It's involved with a low respiration, a high blood pressure, and a low pulse. The body's going to compensate right away. RAS is going to kick on, your sympathetic nervous system is going to kick on, blood pressure is going to increase. So that's why it's very important to monitor that. Low respirations and a low pulse is going to occur. Also, we want to monitor for intracranial pressure for the first 72 hours. Just to make sure the patient's on the safe side. All right, so we covered all the nursing diagnostics, the medical treatment that's involved, the pathophysiology, and much more, especially in the anatomy and physiology side. If you like this video, please like and subscribe and share. And thank you and have a great day.